Dearest ladies and gentlemen, in today's sharing session, we will delve into a health issue that, while often silent, is incredibly urgent, a topic many of us might be facing without even realizing it. This concerns early detection methods for the presence of H. pylori bacteria in the stomach through 3 self-checkable signs you can look for at home, completely without the need for complex procedures like endoscopy or expensive tests. If you often experience a dull ache in your stomach, frequent heartburn, and feel tired and sluggish after every meal, then this video is for you. It's very possible these are the initial warnings H. pylori is subtly sending your way. What is H. pylori and how dangerous is it? H. pylori, whose full scientific name is Helicobacter pylori, is a spiral-shaped bacterium with a unique ability to survive and thrive within the mucus lining of the stomach, an extremely acidic environment that most other organisms cannot tolerate. More alarmingly, it is the only bacterium officially classified by the World Health Organization, WHO, as a Group 1 carcinogen, meaning there is strong scientific evidence of a direct link between it and stomach cancer. Recent statistics estimate that up to 50% of the Vietnamese population carries H. pylori. However, a concerning reality is that the vast majority of these individuals are unaware they harbour the pathogen. This is because the bacterium tends to operate silently, showing no clear symptoms in its early stages. H. pylori is considered the primary cause behind a wide range of common stomach ailments, from gastritis and peptic ulcers, gastrointestinal bleeding, and most seriously, stomach cancer if not diagnosed and intervened with in time. That said, not everyone infected with H. pylori immediately develops stomach pain, and conversely, not all stomach pain is caused by H. pylori. The real danger lies in the fact that this bacterium can hide in our bodies for many years, slowly causing damage that the patient may not recognize until the disease has silently progressed to a more severe stage. 3 often ignored home warning signs of H. pylori bacteria. First sign: persistent bad breath, despite thorough oral hygiene. One of the subtle yet extremely valuable signs in people infected with H. pylori is persistent bad breath, especially noticeable in the morning after waking up. What's concerning is that this foul odor doesn't stem from common dental problems like cavities or gum inflammation, but rather originates deep within the stomach, where H. pylori is colonizing and actively operating. Even if you maintain a habit of brushing your teeth twice daily, rinsing with salt water, or even using dental floss and antibacterial mouthwashes, if your breath still has a strong odor, especially when your stomach is empty or after consuming fatty foods, then that's a warning signal from deep within. So why does H. pylori cause this condition? When parasitizing the stomach, H. pylori produces chemical compounds, notably ammonia gas and sulfur-containing compounds. These gases have a very pungent and unpleasant odor. They are released when the stomach contracts to digest food or when ulcers are irritated, then travel up the esophagus and into the oral cavity, causing an odor that external hygiene cannot fully resolve. This condition often appears along with a bitter taste in the mouth, a dry throat in the morning, or a slightly burning sensation on the tongue and loss of appetite. A small but very useful tip for self-assessment at home is to observe the surface of your tongue in the morning before eating or brushing your teeth. If you see your tongue covered by a thick, off-white or yellowish coating that is difficult to clean with a toothbrush, then it's highly likely your digestive system is having problems. And the leading potential cause is H. pylori multiplying in the stomach lining. A thick tongue coating accompanied by persistent, unexplained bad breath is a simple yet extremely useful clinical symptom for early detection of gastrointestinal infections. Many people often mistake it for simply being internal heat or due to eating too many spicy foods, but in reality, it could be the initial manifestation of a chronic stomach condition, especially if this condition lasts for more than 2 weeks without any signs of improvement. It's not uncommon for patients to be shocked to discover they've been infected with H. pylori for a long time during a routine health checkup. They had lived with persistent bad breath for months, even years, simply thinking it was due to poor hygiene or diet. However, when tested via breath test or endoscopy, the results showed that H. pylori had been present for a long time, causing inflammation and ulcers in the stomach lining. Once H. pylori has multiplied significantly, the treatment process becomes more complex and requires more time, sometimes necessitating a combination of high-dose antibiotics. Therefore, never be complacent when bad breath persists, despite meticulous oral care. Remember, bad breath is not just a social issue. It can be the first alarm bell for a silent disease called Helicobacter pylori, the stomach's #1 enemy. And if you are facing this situation, do not hesitate to get checked early to take definitive action before it's too late. Second sign: feeling full, sluggish and burping, especially after meals or when hungry. One of the classic yet often downplayed symptoms by patients is a sluggish, bloated feeling and continuous burping, especially after a full meal or even when the stomach is empty. This symptom may sound normal, But in reality, it's a clear sign that the stomach is having problems with its digestive function, and the hidden culprit could very well be H. pylori. When H. pylori persists in the stomach lining for a long time, it destroys the natural protective layer, causing abnormal stomach acid secretion, sometimes too much, sometimes too little, leading to an imbalance in the digestive environment. As a result, food is not processed and passed through in a timely manner, leading to stagnation, fermentation, and gas production directly in the stomach and intestines. People infected with H. pylori often feel very heavy after meals, not just a normal feeling of fullness, but a sensation of distension and discomfort, especially in the area above the navel. Some people feel completely full after eating only a small amount of food, don't want to eat more, and burp incessantly. Conversely, some experience this condition most clearly when their stomach is empty. For example, in the early morning before eating anything, they experience heartburn, or annoying hunger accompanied by a dull ache in the epigastric region. Some people even feel their breath smells like old food, or have a burning acid reflux sensation in their throat, causing slight nausea. These are signs that the stomach is not functioning stably. One of the specific manifestations of H. pylori is slow digestion, meaning food remains in the stomach longer than usual, making the patient always feel like their stomach hasn't fully digested the meal even hours after it ended. Additionally, the gas produced from food fermentation is not effectively released, causing the lower abdomen to feel tense and distended, as if filled with water but without severe pain, only dull and prolonged. This often leads many people to be complacent and assume it's just a common digestive disorder. However, if symptoms like bloating, distension, and heartburn occur continuously for more than 2 weeks, that's a very valid reason to suspect that the stomach is suffering from chronic damage caused by H. pylori. Not a few cases of patients came to the hospital thinking they had irritable bowel syndrome or mild enteritis, but test results showed that H. pylori was silently causing stomach ulcers, creating a series of prolonged disorders from the upper to lower digestive system. Especially for middle-aged and elderly individuals, when natural digestive function has declined, these symptoms are even more easily mistaken for the aging process. Therefore, if you often feel bloated, have indigestion, and burp a lot accompanied by a burning sensation in your abdomen, please do not dismiss it lightly. Consider the possibility of H. pylori infection, especially if these symptoms last for more than 2 weeks and do not improve despite dietary changes. Third sign: dull epigastric pain at night or when hungry. One of the most characteristic yet often overlooked signs of H. pylori infection is a dull ache in the epigastric region, the area between the breastbone and the navel, corresponding to the stomach's location. This pain is not severe or agonizing like appendicitis or other acute pains, but usually appears as a persistent, lingering ache. Sometimes it's a burning sensation, other times it's an uncomfortable, empty or gnawing feeling, especially when hungry or in the middle of the night. These are the times when the stomach is empty, with no food to neutralize excess acid. This causes the already H. pylori damaged mucus lining to be even more strongly irritated by acid, leading to vague but persistent pain. Many people report being woken up around 2 to 3 a.m. without understanding why. When they listen more closely to their bodies, they realize their upper abdomen feels a bit hot, with a gnawing sensation accompanied by slight nausea or a dry mouth. During the day, this sensation may be faint, but when hungry, especially before meals or when stressed, the pain returns. Some even find the pain becomes more pronounced after drinking coffee, eating spicy or sour foods, or using painkillers. This is a classic characteristic of stomach lining ulcers caused by H. pylori. However, the danger is that many people mistake this pain for stress-induced stomach pain, abdominal muscle cramps, or just a common digestive disorder. They may self-medicate with a few packets of antacids, or eat some crackers to temporarily soothe the pain, without realizing the root cause is bacteria gradually eroding the stomach lining. When combining this sign with the 2 previously mentioned signs, persistent bad breath and bloating, there's a very high probability you are carrying H. pylori. Especially if epigastric pain appears cyclically at night and lasts for more than 1 to 2 weeks, you absolutely should not hesitate. This is no longer a mild sign, but a warning that the stomach is being damaged at a cellular level, and H. pylori is the silent culprit behind it. In reality, it's not uncommon for patients to only discover the severity of their condition, progressing to severe ulcers, gastrointestinal bleeding, or even the risk of developing stomach cancer, simply because they dismissed mild stomach pain when hungry. For the elderly, whose immune systems are weakened and cellular regeneration is slower, late detection makes the treatment process more difficult, costly, and increases the risk of recurrence. Therefore, if you or your loved ones frequently experience a dull ache in the upper abdomen, especially when hungry or at night, please do not underestimate it. Proactively consider the possibility of H. pylori infection and get tested, especially if this sign is accompanied by bad breath and prolonged indigestion and bloating. Early detection and early treatment are the most effective methods to protect the stomach from dangerous complications later on. So, what should we do if we suspect H. pylori infection? When you start to notice suspicious signs, such as persistent bad breath, indigestion and bloating, or a dull ache in the epigastric region, especially when they last for several weeks without improvement, then it's time to act. Diagnosing and treating H. pylori as early as possible will help prevent serious complications such as chronic stomach ulcers, gastrointestinal bleeding, and further on, stomach cancer. Currently, there are 3 common and relatively accessible testing methods. Each method has its own advantages and disadvantages, suitable for specific cases. 1. Urea breath test, highly recommended method. This is a modern, non-invasive, and highly accurate H. pylori test with a sensitivity of up to 95 to 98%. You simply swallow a pill containing a marked carbon molecule, then breathe into a specialized device. If H. pylori is present in the stomach, it will break down this compound and produce a specific gas that the detector picks up through your breath. The entire procedure only takes about 15 to 20 minutes, is painless, doesn't require a long fast, and usually yields results on the same day. 2. Stool antigen test for H. pylori. This is a convenient method that can be performed at home by collecting a stool sample yourself and sending it to a laboratory. This method helps detect the presence of antigens, a part of the H. pylori bacterium in the digestive tract. Its advantages are low cost and ease of execution, but its sensitivity is often lower than the breath test, and it may yield inaccurate results if the specimen is not collected and stored correctly. 3. Gastroscopy and biopsy, when severe damage is suspected. In cases where patients have severe or prolonged symptoms, especially with alarming signs such as vomiting blood, black stools, or unexplained weight loss, the doctor will recommend an endoscopy. This method allows direct visualization of the stomach lining and collection of a small tissue sample for H. pylori testing. Although it can cause discomfort, endoscopy offers the highest diagnostic value, helping to accurately assess the extent of mucosal damage and the status of the infection. If you only have initial suspicious signs and want to get checked quickly, prioritize the breath test at reliable medical facilities. This is the optimal choice for those checking for H. pylori for the first time or those wanting to monitor effectiveness after a course of treatment. If you suspect yourself or a family member has signs of H. pylori infection, please do not hesitate. Why is early detection of H. pylori so important? H. pylori is one of the most silent yet formidable invaders of the human digestive system. Its danger lies not in causing dramatic symptoms, but precisely because it causes no clear symptoms in its early stages. Many people live with H. pylori for years without knowing, because they only feel vague symptoms like fatigue, slight bloating after meals, or occasional dull aches. But hidden beneath that silence is a subtle and persistent destructive process on the stomach lining. Over time, if left undetected and untreated, H. pylori will lead to gastritis and peptic ulcers, which can progress to gastrointestinal bleeding, and especially stomach cancer, one of the leading causes of cancer-related deaths in Vietnam. More concerningly, stomach cancer is often only detected in its late stages, when treatment methods become extremely complex and less effective. But there's good news. If diagnosed early, H. pylori can be completely eradicated after just a 1 to 2 month treatment regimen, involving a combination of antibiotics, acid-reducing medications, and a scientific diet. Millions of people worldwide have successfully treated H. pylori, and their stomachs have had the opportunity to fully recover thanks to early detection. Especially for middle-aged and elderly individuals, regular H. pylori screening becomes even more crucial, as this group is at a much higher risk of complications. You don't need to wait until stomach pain becomes severe to get checked. If you notice any suspicious signs like bad breath, burping, or a dull ache in your upper abdomen, be proactive and get screened as soon as possible. Early detection not only makes treatment easier and faster, but also serves as a way to protect the long-term digestive health for ourselves and our families. In conclusion, H. pylori, though invisible, has a silent and persistent destructive power over our stomachs. The greatest danger lies in complacency and lack of awareness. Just a few seemingly ordinary signs, like bad breath, a bloated feeling after meals, or a dull ache at night, if ignored, can lead to extremely serious consequences. Learn to listen to your body. If you or your loved ones have any of the signs shared, please do not hesitate. Get checked for H. pylori as soon as possible. Especially for middle-aged and elderly individuals, regular H. pylori screening is an incredibly necessary step to proactively prevent stomach cancer. And if you found this video valuable, please share it immediately with your family and friends. Because who knows, even this small piece of information could help someone detect the disease early and avoid unforeseen complications. Are you unknowingly infected with H. pylori? Don't forget to subscribe to the Golden Wellness 50 channel and hit the notification bell to not miss the latest videos on health, beauty, and healthy living. See you all in the next videos.